Hello, this is Tony Heller from RealClimateScience.com, setting the record straight about science. In this video, I'm going to discuss 32 years of expert testimony before Congress. The press describes Anthony Fauci as the top infectious disease expert in the U.S. Yesterday, Dr. Fauci testified before Congress. He said that he was cautiously optimistic that a COVID-19 vaccine will be available by the end of 2020. But a month ago, the team developing the vaccine at Oxford University said the virus was disappearing so fast they weren't sure they would ever be able to test their vaccine. And earlier this week, another expert said the same thing. COVID-19 is weakening, could die out without a vaccine. A few weeks ago, Dr. Fauci said that he was confident that they would be able to develop a vaccine because most people can fight off the virus themselves. So why is Dr. Fauci still talking about a vaccine for a virus which is disappearing and which most people already have natural immunity to? What Dr. Fauci is talking about doesn't make any sense, but the press describes him as the top infectious disease expert in the U.S. The reality is that Dr. Fauci is an immunologist, not an epidemiologist, so his expertise is in vaccines. The saying goes that when you're a hammer, everything looks like a nail. Well, Dr. Fauci is a vaccine guy, so everything to him looks like an opportunity for a vaccine. Let's look at the data now. This is the graph of daily deaths from COVID-19 in the United States. You can see that COVID-19 deaths peaked in the United States in mid-April, around the time when Governor Cuomo was sending large numbers of sick people into nursing homes. But since then, COVID-19 deaths in the United States have dropped off sharply. It should be down pretty close to zero in a few weeks. Dr. Fauci's vaccine looks like it'll be completely useless, but he's holding the country hostage and talking about not opening schools up until he gets his vaccine. So here's another article yesterday from the New York Times using the identical language as that used by Twitter. They describe Fauci as the top infectious disease expert in the U.S. Again, Dr. Fauci is an immunologist, not an epidemiologist, so he really has the wrong expertise for managing an epidemic. He only has one tool in his bag, which is vaccines, but managing an epidemic requires a much broader view. Dr. Fauci told Congress that the next couple of weeks will be critical in addressing a disturbing surge of infections as states reopen too quickly and without adequate coronavirus testing. On Dr. Fauci's advice, states have adopted policies which have put more than 40 million people out of work. COVID-19 deaths are rapidly declining in the U.S. and should be close to zero in a few weeks. Yet Dr. Fauci says that we're reopening too fast. The reality is that the U.S. is facing a very serious situation in the near future. A few weeks from now, stimulus unemployment benefits are going to run out and people are going to start getting evicted from their homes. If something doesn't change very quickly, parts of the United States are facing the prospect of mass homelessness, crime, and disease. Yet Dr. Fauci seems to be oblivious to what's already happened and what's likely to happen in the near future. Now let's look at the disturbing surge of infections which Dr. Fauci was talking about. This is the graph of total reported U.S. cases of COVID-19. You can see that there's been a rise over the last couple of weeks. But taken out of context, this graph is pretty useless. On Dr. Fauci's advice, testing has been ramping up very rapidly. If you test twice as many people, you're going to detect twice as many infections. So the graph needs to be normalized based on the amount of tests being done. And if we do that, we see something completely different. Using data which correctly accounts for the number of tests being administered, you can see that COVID-19 cases in the United States are down more than 3/4 since mid-April. There has been a small uptick in recent weeks, which was probably largely due to mass looting, rioting, and protesting. Dr. Fauci didn't seem interested in that, and instead blamed the rise in cases on states allowing people to work. The press has focused a lot of their attention on Arizona, where one hospital group says they've seen an increase in hospitalizations. But if we go to the State of Arizona website, we can see in this graph at the bottom what's going on. During the week of June 14th, they had a record high number of nursing home infections. This has nothing to do with lockdowns, and if the press was interested in keeping down hospitalizations in Arizona, they'd be focused on finding out why the nursing homes got infected that week. The key to keeping hospitalizations and death down is protecting our senior citizens, particularly those in nursing homes. The press ignores this, of course, and instead focuses on lockdowns. For some reason, they're obsessed with keeping young people unemployed and keeping young people from enjoying life. This graph shows occupancy at one of Arizona's largest hospitals over the past month. There's two sets of data. One is from this year and one is from last year. The graphs at the top show inpatient census in 2019 and 2020. And the graphs at the bottom show emergency room activity in 2019 and in 2020. If you look at the graph closely, you can see that at least some large Arizona hospitals are less busy this year than they were at the same time last year. Now let's look at what's really going on in Arizona. Smead Capital Management, which handles about $1.5 billion in accounts, is leaving Seattle and moving to Phoenix. This company is obviously not too worried about COVID-19 in Arizona. What they're concerned about is the oppressive business environment in Democrat-run Washington. This chart shows the states with the 11 highest COVID-19 death rates in the United States. Going down the list, we see New York, New Jersey, Connecticut, Massachusetts, Rhode Island, District of Columbia, Louisiana, Michigan, Illinois, Delaware, and Maryland. These states account for more than two-thirds of the COVID-19 deaths in the United States, and all are either heavily Democratic or they have a Democratic governor. The reality is that Republican-run states are much safer than those states which are run by Democrats. Dr. Fauci cited a small increase in cases as evidence that the U.S. was opening up too quickly. But if we look at the data from Sweden, which never locked down, it becomes pretty clear that Dr. Fauci doesn't know what he's talking about. Deaths in Sweden peaked in mid-April just like they did in the United States, and for the same reasons. Their nursing homes got infected. But since mid-April, the Swedish curve looks very similar to the U.S. curve. Deaths are rapidly declining and should be close to zero in a few weeks. Sweden did this without lockdowns, providing pretty strong evidence that lockdowns are worthless. This study comparing the United Kingdom and Sweden shows that Sweden did better with no lockdown than the United Kingdom did with a hard lockdown. The virus is disappearing and deaths are plummeting, so why is Dr. Fauci still talking about a vaccine and talking about not reopening the schools until a vaccine becomes available? This BBC article makes it pretty clear. Bill Gates wants to sell 2 billion vaccines, and the CDC and the World Health Organization have both taken a lot of money from Bill Gates. Dr. Fauci is a vaccine guy. He's not an epidemiologist, and he's definitely not an economist. He's not the person who should be setting policy. Policy needs to be set by elected officials like the President of the United States, not unaccountable public servants. Now let's go back in time exactly 32 years to a different testimony before Congress. On June 23, 1988, NASA's James Hansen testified before Congress and started the global warming scare. It was one of the hottest days on record in the northeastern U.S., and in fact Senator Tim Wirth, who organized the event, planned it that way. Senator Wirth later bragged to PBS that him and Dr. Hansen went into the meeting room the night before and sabotaged the air conditioning system. They wanted everyone in the room to be extremely hot and to blame it on global warming. This is an incredibly dishonest thing to do, but it's par for the course for climate alarmists. The U.S. was having a terrible drought and heat wave that year. The Mississippi River nearly dried up, and a large part of Yellowstone National Park here in Wyoming burned up. Hansen made some very specific predictions. He predicted a huge increase in the number of 100-degree days in both Omaha, Nebraska, and in Washington, D.C., and he made the same prediction for days over 90 degrees. Let's see how Dr. Hansen did. Ashland, Nebraska is the closest United States Historical Climatology Network station to Omaha. This graph shows the number of 90-degree days at Ashland, Nebraska every year since 1895. And you can see that there's been a sharp drop. 90-degree days at Omaha now occur about half as often as they did in the late 19th century. Hansen got it exactly backwards. And there's been a particularly sharp decline in the number of 90-degree days over the last 20 years. This graph shows the same thing for 100-degree days at Ashland, Nebraska. They peaked during the 1930s and have dropped sharply since then. Once again, Hansen got it exactly backwards. Hansen also predicted a big increase in drought in the Corn Belt. Once again, he got that exactly backwards. This graph shows precipitation in the Corn Belt, which has been steadily increasing. Has been at a record high in recent years. I was in Nebraska the last few days, and it sure didn't look to me like they were having a drought. Now let's go to Washington, D.C., which Hansen also predicted a large increase in the number of 90 and 100-degree days. Lincoln is the closest Virginia, United States Historical Climatology Network station to Washington, D.C. This graph shows the number of 90-degree days every year since 1900 at Lincoln, Virginia. The number of 90-degree days at Lincoln, Virginia has plummeted since the 1930s. Once again, the exact opposite of what Hansen forecast. And the same story with 100-degree days, which peaked in 1930 and have dropped way down since then. Hansen got that story exactly backwards again. Hansen also predicted a big increase in drought in the southeastern United States, but the exact opposite has occurred. The southeastern U.S. has been getting steadily wetter over time since the 19th century, with recent years being among the wettest. Another forecast which Hansen got backwards. These graphs are from the National Climate Assessment, and they show heat waves across the United States. As you can see, they peaked in the 1930s, and U.S. heat waves have generally been much less severe over the last 60 years than they were in the 60 years prior to that. Once again, Hansen got everything exactly backwards. Also in 1988, NASA's James Hansen predicted that lower Manhattan would be underwater within 20 or 30 years. So Wall Street should have been underwater no later than the year 2018. Obviously, Hansen got that forecast wrong too. The biggest damage which Wall Street has incurred recently was that done by the World Health Organization and aided by Dr. Fauci. Here's another forecast from Dr. Hansen. In 2008, Dr. Hansen predicted that the Arctic would be ice-free sometime between 2013 and 2018. Democrats called him a prophet. This is today's ice map from the National Snow and Ice Data Center in Boulder, Colorado. It definitely doesn't look like the Arctic is ice-free. Just like climate alarmists, COVID-19 alarmists have no idea what they're talking about. A few months ago, the New York Times was predicting more than 2 million deaths in the United States. These predictions were made based off of completely worthless computer models from Andrew Ferguson in the UK. Tens of millions of people were put out of work because of useless computer models which had non-deterministic outputs and were not usable for scientific purposes. There was no code review done at the time, and the amount of damage done by the press and by governments based on these useless models is rather astonishing. I come from an engineering world where everything has to be absolutely perfect, but government and academia come at the other end of the spectrum. Policy is being driven by completely incompetent scientists who have no idea what they're talking about. J.P. Morgan did a study showing that infection rates dropped after lockdowns ended. So why is Dr. Fauci still talking about keeping the lockdowns in place? The virus is disappearing, death rates are plummeting, but we're faced with the possibility of a huge number of homeless people in the not-too-distant future. This is what policy should be focused on, not a disappearing virus. Abraham Lincoln said, "You can fool some of the people all of the time, and all of the people some of the time, but you cannot fool all of the people all of the time." Toto doesn't get fooled easily, and he spends a lot of his time sniffing out government scams. Visit him on the web at realclimatescience.com. Toto has been pulling back the curtain on junk science and propaganda for a long time.